everyone, I'm Cass and this is the Mind Your Being podcast, a space where we'll explore health and what it really means to care for our whole being, our physical, mental and emotional health. Each episode you'll hear from leading health and wellness experts or everyday people who share powerful insights and lived experience. And sometimes it'll be just me, sharing thoughts, tools and reflections from my own journey. More than anything, I want you to feel supported, encouraged and empowered to make informed health choices that feel right for you. If this sounds good to you, please enjoy. Hi, and welcome to all our Mind Your Being listeners, whether you're tuning in here from Australia or from the US, Europe, Singapore, South America and beyond. I'm so grateful for all of you and for the incredible support you've shown the podcast. In episode 3, we had a powerful conversation with Dr. Lisa Cochrane about all things menopause, and the response from you all has been just amazing. Many of you reached out with thoughtful questions, and today Dr. Lisa has kindly agreed to join me again to dive a little deeper and answer some of your listener questions. Dr. Lisa is a highly respected lifestyle medicine physician with a passion for helping women navigate midlife with confidence and evidence-based strategies. I'm delighted to welcome her back to the podcast. Welcome back to Mind Your Being, Lisa. How are you?
Thank you so much, Cass. I'm really well. Yeah, it's been lovely to hear that women have had some extra questions and that the first podcast episode generated a bit of interest and I think maybe piqued women's curiosity. So yeah, I'm very happy to be back and answer some really good questions.
Thank you so much. And I must say that yes, it did pique the curiosity of the listeners, your episode. It was episode 3, which was called Making Sense of Menopause, Symptoms, Solutions and Support. And to date, it's been the most downloaded episode of the Mind Your Being podcast so far. So thank you.
Oh, great. Well, I'm glad that it's really helpful. I think it's a really challenging time and there's a lot of information out there. It's often sometimes really hard to know where to go to have your questions answered accurately.
Yeah, that's right. There's so much noise and it seems like every other person is talking about menopause, but online they're not all qualified, unfortunately, and you are, so you're back here today. Thank you.
Great.
So we have a range of questions. So let's start off with this first one. Everyone's heard about the hot flushes that can come with perimenopause, menopause. Have you heard of women experiencing cold flushes? And if you have, are these common and is there anything listeners can do about them? And does hormone replacement therapy help?
Such a good question. So yes, cold flushes are a thing. It's probably helpful to break it down into 2 categories. So some cold flushes, which is a sense of just suddenly being overwhelmed by feeling quite chilly. You might get goosebumps. You might get a bit shaky. It's usually short-lived. So not like let's say when you're sick with the flu and you might have a fever and get the chills, and that can go on for quite some time. A cold flush is something that will come for a short period of time and a wave and then go away, a little bit like a hot flush. So sometimes it's just because it's the rebound from having had a hot flush. So you feel super hot and really overwhelmed with that wash of heat. And then you might feel sort of comparatively a bit cold afterwards. But there are just cold flushes themselves that are independent of hot flushes. And they don't necessarily happen at the same time. Basically, in perimenopause and onwards, our thermostat in our brain goes a bit haywire. And we've got a thermostat in this part of our brain called the hypothalamus, and it really regulates our temperature. It regulates a few of the other things in our body, like blood pressure, that we don't really have a lot of conscious control over. And when our estrogen starts to drop, then the estrogen is what communicates with this thermostat in our brain. And you start to take away the estrogen and the thermostat doesn't know that it's supposed to actually keep us at a nice temperature. So hot flushes happen because of low estrogen levels. In perimenopause, estrogen levels are all over the place. They're absolutely nuts. So instead of being nice and even, they just sort of go up and down very randomly. So you might find there are times where you have actually more estrogen than what your body's used to, and that can sometimes trigger a sense of cold. The other thing that can happen is that we're much, much more sensitive to small changes in temperature when our estrogen is on the way down. So even though the room might not be particularly cold, you may find that that you feel colder than somebody else. So yeah, so cold flushes are a thing. Yes, hormone therapy can help. So essentially what menopausal hormone therapy does is replace your estrogen levels back to a pre-menopausal state and keep them nice and even so they don't have these crazy ups and downs that we experience. So yes, it helps. And actually, hormone therapy is it is overwhelmingly the most effective treatment for hot and cold flushes.
Thank you. Our body is so interesting, isn't it?
Yeah.
Okay, so the next one is, why do I feel so tired all the time, even when taking hormone replacement therapy? That's quite a common question, I think.
Yes, and I love this question because it is so common. I'm not sure. I've had many women come through my door who say that they're feeling, boundful with energy, and and so low energy is a really, really common thing. And I think it's very important to start to think about what we experience in our body and how much we can blame on menopause. So we can blame a lot of stuff on perimenopause, but when your menopausal hormone therapy treatment is adequate, and there's a few ways of knowing that. So let's say all your other symptoms are much better, like you're sleeping better, your hot flushes are better, maybe your urinary symptoms are better, but you just still feel tired. That always is a bit of an alarm bell for me. And I think, well, I don't really want to blame this on menopause. I think we should look for other reasons. So yes, there's a possibility that it could be related to menopause. We know that energy levels do go down, but it is a red flag to start thinking about other reasons for low energy. So there are about a bazillion reasons for why you might be having low energy, but probably the common ones would be things that we can measure. So things like low iron, low B12, poor thyroid function. So these sort of measurable functions of our body that aren't working properly. So it's really important, if you do have that lethargy and that tiredness, please go and see your GP, because there's a lot of things that we can rule out or find out really easily just on a simple blood test. Then probably the more complex and a bit more nuanced side of that sort of tiredness picture is often lifestyle. And lifestyle changes is something I'm very interested in and very passionate about. And I tend to find that at around that perimenopause and menopause time, a lot of us are just doing all the things, so many things. And we probably do underestimate what the things that are draining our energy. So energy drains could be things like just being so busy that you don't have time to cook your meals at home, or being so busy that the default option when you come home is just collapsing on the couch and having Netflix and corn chips. Or, there's lots of different ways that we sort of manage that tiredness. And I think a lot of those habits that we get into, sometimes that's actually what's fueling tiredness. Probably the other really big one to think about is when we go into perimenopause and menopause, we actually really change the way our body digests and handles food. So we're much more sensitive to carbohydrates, and we become much more insulin resistant. So often our blood sugars become a bit higher. Not that we're diabetic necessarily, but our blood sugars aren't as well controlled. And that often looks like feeling really sluggish in the afternoon, really craving lots of carby snacks in the afternoon or just before bed. But it really has a huge impact on our energy levels as well. And yeah, the other sign often women notice is that they might start gaining some weight around the middle. So Yes, some of these things are related to perimenopause and menopause, and some of them aren't. So it's worthwhile certainly having a chat with your GP, and seeing if you can tease out what the contributing factors are. Because, in my experience, it's almost never just one thing.
It's great. And I'm very passionate, like yourself, about lifestyle medicine and trying to look at a bit more prevention rather than the cure, look at a balanced lifestyle.
Mm.
But that's a really good reminder for people that maybe haven't had a checkup in a while. There's a few key measurables there that you mentioned that we can have a look at as well, for sure.
Yeah, absolutely.
This is actually a question from me.
Okay.
The question is, I feel like my allergy symptoms, runny nose, watery eyes, which I've had since I was young, really, I feel like they've gotten worse when I increase the estrogen gel to the 2 arm dose or the 2 leg
Mm.
dose a day, up from the 1 dose a day. Yeah, when I increased it, maybe a week or two, I noticed I felt like I had all the cold symptoms, but I didn't actually have a cold. So then I went down to 1 arm dose again, see if it would, and it improved a bit, but I still have them. So my question is, could these allergic symptoms and them getting worse, could that be related to the HRT that I'm taking?
Yeah, it's a great question. And the answer is definitely yes. It's not uncommon that this happens. So, when we have stable estrogen levels in our body, then we don't tend to get to have those ups and downs. When we introduce some external estrogen, the estrogen can attach to something called a mast cell in the body. And mast cells are actually part of the immune system. And when they're activated, they can release histamine. And histamine is what makes you all sneezy and snuffly and itchy eyed. So it's really common that we find women who are prone to having more of that allergic type of genetic. So it doesn't tend to come out of nowhere. People genetically have more of a predisposition towards having sort of hay fever and allergy symptoms compared with other women. So if you're a bit sensitive, then it may well be that increasing the estrogen means that that estrogen is interacting with these mast cells more. They're releasing more histamines and you're getting more symptoms. Now, it's not a true allergy. So we think about allergies and we get worried about allergies, things like anaphylaxis. This is a different sort of mechanism to that. Obviously, it's still no fun to have. We don't want you to have those symptoms. But it's really helpful to look at what are the other variables that might be playing into it. So for some women, it might be that you need to have a look at some of the other triggers for the histamine reaction, because yes, estrogen will be a contributing factor, but there's probably other environmental factors that come into it. So it might be, say, some histamines in the diet. There might be, seasonal pollens coming into spring, even things in the house that might trigger it. So a lot of times women will find that they're sensitive to say, scented candles or scented hand lotions or cleaning products. So trying to reduce your overall burden of the things that are likely to trigger histamine reactions may actually mean that it becomes less of an issue for you. Having said that, some women do really struggle to clear those estrogens from their body and will continue to have symptoms. There are some more specialized GPs around who work with women who have this issue, which we call mast cell activation syndrome. And there's a bit of a process that you can go through to help wind back some of that reaction, so that maybe you can push the dose up to a dose of estrogen that actually does help your symptoms. Because of course, there's going to be a bit of a risk to benefit ratio. You don't want to increase your estrogen if you're going to get all those symptoms. So yes, it's a really common thing we find actually for women who are prone to to allergies.
Thank you. It's good to hear it's common. And I
Yes.
have recently been reading up about the mast cell activation syndrome. I bought a book talking about different gut issues and the
Mhm.
histamine in the food. So I'm
Yep.
learning which foods, which as you would expect, are foods I love, like avocado and tomato. So yeah, I'm going to try tailoring that down a bit and see if that helps as well.
Yeah, and I think the other thing to look into, and it's not appropriate for all women, and it definitely requires a discussion, I suppose, with the prescribing doctor. The I suppose that histamine reaction tends to be less prominent for women who use oral estrogen tablets. So we don't have any oral bioidentical estrogens that act in the same way as the gel. So there are other issues. But for some women who say, I just need my estrogen and I need to not have these symptoms, then there are other options for the estrogen component of the menopausal hormone therapy that might sort of circumvent some of those histamine issues. So, but it's a pretty complex and a bit nuanced area, and it requires a bit more research. It's not something that is well or commonly understood, I suppose, by most doctors. So yeah, it's worthwhile having a good chat with someone about it.
Yeah, definitely. I think it's emerging, like you say, and some more research. I think it's coming, but yeah, for now, we'll trial and error a few things.
Exactly, yes. Yeah.
Thank you. Next question. I love the HRT patches, but am crazy allergic to the adhesive used on the patches. I'd love to know if there are different brands of patches with different alternative adhesives.
Yeah. So, yeah, it's unfortunately, much like a lot of people are allergic to, say, Band-Aids and other sorts of tapes, it's not uncommon to see allergies to the patches. Now, I suppose one issue with the patches is that they're very hard to come by. So there's not a lot of variety in Australia at the moment. There's a real logistical issue in actually getting the patches into Australia. It's sort of more of a regulatory supply problem. There's nothing wrong with the patches. They're great if you can get them, but they're very hard to come by. So even if there were alternatives, sometimes they can be incredibly difficult to actually change the brand, even if you wanted to. But let's say in a perfect world, we had a whole range of different patches we could choose from, then absolutely, in theory, it's completely reasonable to try a different brand. So the estrogen component or the hormone component of any patch is actually in the glue. It's in the adhesive of the patch. And so different companies will have different formulations, but it does depend a little bit on how sensitive you are. If you're, if this lady says she's crazy allergic and maybe she's got a history of allergies to other sorts of adhesive, I'd say the likelihood of success of trialing a brand that isn't going to do that is pretty low. But if it's only ever happened once to this one brand, then absolutely, I think it's reasonable to try others. It's not harmful overall. It's obviously unpleasant and uncomfortable, and will give you, an interruption in your hormone therapy if you have to, try different ones and take them on and throw them away early. But inherently, it's not dangerous as such. So yeah, if we can try a different brand, but I think if two brands causes an allergy, I'd say Gel's a great alternative. Although it's theoretically possible to have an allergy to it, I have never seen it happen. It's usually really, really well tolerated. So that could be another good option. It's exactly the same medication. We can get exactly the same levels of estrogen in your body. So that would probably be the next best thing.
Can I swim with HRT patches on? Does the water make the patches come off, or does it negate the dose of the hormones?
No, it doesn't negate the dose of the hormones. And yes, you can go swimming. Absolutely. So I suppose the most important thing is probably just to make sure that the edges, I'm pointing at my bum, where people usually have their patch muscle memory. So as long as the outside of the patch doesn't have any little gaps or it's not flapping around where the water can get underneath it, then that should be absolutely fine. And look, some people also do choose to put an extra dressing on top of it. If it's, if you're at sort of day 3 and it's getting a bit tatty around the edges, then you might want to stick it down. But no, other than that, you can absolutely go swimming with it. That's fine.
Wow, that's great. Following on from that one, if I place the estrogel on my body early in the morning, say 8 a.m., and then go swimming around 12 noon, so maybe 4 hours later, will I have absorbed the full dose of the hormones in that 4-hour period prior to swimming, or is it a wasted dose?
You will definitely absorb as much as your body can possibly absorb in that time. So it's very reasonable to put your estrogel or your Sandrina gel on. Give it an hour. Really, that's pretty conservative. So once you've put it on, you'll probably notice, as somebody who uses gel, let's say you put it on your arm or your leg, and you'll notice that it's in an alcohol base. It has that sort of alcohol smell to it. Now that alcohol will evaporate off and leave the estrogen on the skin, and the little blood vessels underneath your skin sort of pick it up and take it away and spread it around your body. So that happens pretty quickly. And we know that when the alcohol's all, it's evaporated off, you'll notice that it looks dry. You can't even notice that it's there. Really fairly shortly after that, and well and truly within an hour, you can go swimming, you can do whatever you want. So yeah, it's so long as you give it an hour, then you should be getting the full dose. If you do find that you forget and have a shower after putting it on, just don't reapply it, because the likelihood is that you probably have absorbed a decent amount. And it's probably a bit better to err on the side of safety and just repeat when you're due for your next dose rather than doubling up the dose.
Thank you. That's great advice. Where is the best place on the body to place the estrogen patches?
So the patches have been tested in clinical trials on certain parts of the body. And what we really need is for that patch to be completely stuck on. We don't want any flappy edges. If we've got flappy edges, we know that you're getting an inadequate amount of estrogen. We know that it doesn't stick very well on areas that are really hairy. So it's going to, women's amount of hair is different, in terms of individuality. So you want to try to find somewhere that has a minimal amount of hair, a little bit's fine. And that it sticks down really nicely and all the edges stick down. So ideally it's going to be on your lower abdomen, on the thigh, on the bum. They're probably the best spots. Also just because then they don't tend to get in the way and actually rub off and again get that sort of tatty edge situation. So there are places where I wouldn't put it. So I wouldn't put it directly, say, on the breast. I wouldn't put it on anywhere near the genitals, just because of the high potential of irritability and reactions on that skin. And also because if you're getting a higher concentration being absorbed immediately into the breast, in theory, no one's tested this in practice, but in theory, then you might get much more in the way of localized breast symptoms like tenderness or swelling. So yeah, just wherever it's going to stay on, it's not too hairy and you can fit the whole patch on and it's nice and flat.
Perfect. How about the gel? Where is the best place on the body to apply the gel?
Yeah, so I love it because I've been on Instagram a little bit over the past couple of days, and there are some absolutely cray-cray posts out there about putting their estrogen gel in all sorts of places. So
tell me.
Don't go rogue, please, and don't go on Instagram and be told that you should put your estrogen, in your ear if you have itchy ears or,
Oh my goodness,
or around your crow's feet. Please don't do that. So if we're looking at, there's two different brands of gel that are available in Australia. There's different ones that are available overseas, but in Australia, we've got Estrogel and Sandrina. So again, the companies test these gels on particular sites, which means that we don't actually have any data to tell us how they're absorbed at other sites. So we can really just go on the data they provide, and also in experience. If some women have been using them in a certain area and it seems to work, then we've got sort of anecdotal evidence there. But for estrogel, the best place is on the arm. So it's quite a lot of gel. And when you put one blob of gel on the arm, you usually need the whole surface area of the arm to rub it over. You don't need to rub it in like sun cream. All you need to do is just try to spread it over a relatively thin, it's just an even layer. It doesn't even need to be super thin, but just an even layer over the skin. And then, wait that sort of, 5 to 10 seconds for it to dry. Do one on the other arm if that's your dose. So the arms is where it's been found to have the best absorption. They didn't test it anywhere else, so it's a bit hard to know how it absorbs elsewhere. In theory, it should absorb fine on the outside of the thighs or the lower abdomen. But I don't tend to recommend it just because The arms are easy. That's where they've done the studies. We know that it works. But I just as an example, I've had one patient who has an issue with quite a lot of pigmentation. So when she uses estrogen, she gets and is exposed to the sun, she gets quite a lot of that melasma, which is that sort of brown pigmentation that some of us get during pregnancy. For her, I said, well, look, it's probably better just to put it somewhere where the sun doesn't shine. And so she's elected to use the upper legs, and that hasn't caused an issue. So there are sometimes reasons why I'd suggest maybe put it somewhere else. The other brand is Sandrina. Sandrina is it's exactly the same medication as the estrogel. It's a little bit, the gel is a bit different. So the gel takes longer to dry. That company tested it on the thighs, and you tend to spread it over a small surface area, so about the size of 2 palms. And that seems to be where that's absorbed best. I would say in theory it's probably absorbed fine through the arms, but again, I've got no science to back that up. It's just, it made sense. The absorption also changes depending on what's happening with your skin. So if we're finding that you're not getting a high enough dose, even though we think you probably should, sometimes it helps even just to exfoliate the skin, get rid of the dead skin cells, maybe avoid putting on any other products that day beforehand, like moisturizers, things like that. So yeah, but generally speaking, for the estrogel, the arms; for the Sandrina, the thighs.
It's good that you mentioned too what method they used in the clinical trial, like what method of application. And thank you for mentioning that there are 2 brands of gel in Australia. I wasn't familiar with that. I've only heard of the estrogel, so that's good to know. Just on that, so not applying creams before the Sandrina or the estrogel, how long should we wait again after we've applied the gel in the morning, particularly in winter, if we want to apply a moisturizer to our elbows, arms or thighs?
Yeah, it's a good question. I would say if we're going to be really conservative, I'd probably do them at the opposite ends of the day. So if you, let's say, get up, have a shower, maybe you put your estrogel on then, and maybe you moisturize at night, or vice versa. I'd say otherwise, probably give it about an hour or so. If we think about we're trying to deliver the estrogen onto the skin and have the body absorb it. If we put something else on that can also be absorbed, then it's going to be competing for absorption with estrogen. The other thing that can happen is that it may actually just disrupt that nice layer of estrogen on the skin, and it means it just won't be absorbed at all. So I'd say try to do it at opposite ends of the day, or give it an hour.
Okay, that's good. Thank you. Okay, so this is a good one, I think. Are all doses of the estradiol patch at a therapeutic level for heart and bone protection?
I love this question. So there's different parts to this. So I think it's helpful to probably look at perimenopause and menopause differently. In perimenopause, we're often still making some estrogen. So we may not need as much extra estrogen to get up to that therapeutic threshold. Some women might, but some women don't. So that's not to say that it's not very helpful to have estrogen in perimenopause, because we don't know at what stage in perimenopause you're going to start having, protracted dips in your estrogen levels. So then if we think about postmenopause, then yes, we do need to have a decent whack of estrogen to be able to get to that therapeutic dose. We know that most women will have that bone protection and heart protection at a serum estradiol level of about 250 to 5,300. If you're using the gel, then or a patch, then we can actually measure that level in your blood. If you're taking an oral estrogen, we can't check the level in your blood. I mean, we could check it, but it won't mean anything. So there's a bit of a difference in being able to actually hang our hat on a number and say, yes, that's how much estrogen you have. The blood test is actually quite helpful for women where we don't know if they're absorbing enough estrogen. So some women I'll have on a maximal dose of estrogel and their symptoms won't budge. And so the question is this enough estrogen? Is it being absorbed? So the blood test is really, really helpful in order to tell us that. So how much you absorb from a gel or a patch is quite individual. And some women will absorb all of it. Some women won't absorb nearly enough. But yes, the levels in the patches, so the highest dose of the patch is 100. And in theory, that should give everyone enough estrogen, but it does depend on absorption. And so if that happens, often we might change the site. So, or I might suggest, really go crazy with exfoliating and just make sure the skin's really nice and clean. Or we might change from a patch to a gel or vice versa. But essentially, when we reach that threshold in the blood of about around 250, then yes, unless there's other reasons why women are significantly at risk of osteoporosis or heart disease, then that should be really helpful.
We actually did an episode on mental health and menopause in episode 2 with Professor Lisa Cochrane. And this question is, I'm post-menopause and feeling increasingly stressed and anxious with no particular reason apart from general life stresses. I'm not currently taking HRT. What are my treatment options?
Yeah. It's a really, I suppose all of us have had that experience of anxiety. So it's a very familiar experience. And it definitely does increase for a lot of women, probably around 70% of women in perimenopause. And how long it lasts and how severe it is very variable. We know that mood changes can definitely become worse after menopause. So, 12 months after the last period and there onwards, it can become worse. And depression is certainly much, much more prevalent. Depression and anxiety much more prevalent in women in that post-menopause phase. But a little bit like the tiredness, there are lots of other reasons for anxiety. Was the question also about mood and depression or just about anxiety?
Just about anxiety, but we could
Yeah.
also address mood and depression because I know that's quite prevalent as well for
Yeah.
midlife women.
I'll speak to anxiety first because I think anxiety is something that often does come along with the sorts of things we talked about before where women can become really tired and fatigued. So I don't know. I don't know if you've ever met anybody and if you say, have you got any stress in your life? That anybody would say, no. Everybody has stress in their life.
That's right.
It's absolutely universal. So anxiety can obviously come as a reaction to stress in our lives. The older we get, bad things happen. And unfortunately, they tend to happen more as we get older. So sometimes it can be this sort of slow accumulation of stress throughout the life. And sometimes we just get so busy we don't notice it until all of a sudden our body makes us notice it. And that can sometimes be that menopausal time. So it's important not to, again, blame anxiety completely on menopause. It's almost never 100% to blame. But there are very, very clear brain changes that can lead to anxiety and mood changes for women after menopause. So this lady who asked the question, was she on hormone therapy or not?
No, she said she wasn't currently on it. So, what are her
So
options?
if there are no medical reasons for her to not have hormone therapy, it's entirely reasonable to have a trial of it. If you're going to have an improvement in your anxiety and your mood, you'll well and truly know about it within 6 months, if not much earlier than that. So I would usually say, give it a try, so long as there's no reason not to, then that would be a great place to start, because then we can tick that off the list and say, okay, well, if your anxiety has, gone from a 10 out of 10 to a 2 out of 10, then that's probably the major reason. But if your anxiety has really not moved down particularly much, then we'd need to say, well, perhaps there might be some other reasons that we should look at. What are your stress management techniques that you've got at the moment? How do you react to stress? Sometimes, we're not feeling well in our bodies because we're not sleeping well, we're not eating well, maybe we're not moving. So those things can also really contribute to anxiety. The sleep is, I suppose, definitely one to talk about, and that can also really be helped by hormone therapy. But again, if it's not, we'd have to look at some other ways to try to manage sleep. Just a brief thing about sleep. Something that I tend to find a lot of people haven't heard about that's incredibly helpful is something called cognitive behavioral therapy for insomnia. It's really considered the gold standard for insomnia that isn't caused by things like sleep apnea or dogs barking in the middle of the night, that sort of thing. But it's very helpful. And essentially, it helps us reframe our thoughts about sleep, because I think a lot of us have had that experience of feeling absolutely knackered. You go and lie down, and all of a sudden, like, you have to
The
solve
thoughts.
the world's problems in your head. So that is something that I don't tend to find, medication really that appropriate for, and doesn't tend to work very well for. We need to start to unpack what is, busying our minds and stopping us from getting to sleep. And that's where this cognitive behavioral therapy for insomnia is great. There is a really good online course that I've been prescribing a lot of my patients, and it's done by a group called This Way Up, who are affiliated with Flinders Uni in Adelaide. And they were featured actually on that Michael Mosley. It was a Michael Mosley documentary about sleep, and which is well worth watching if you can't sleep. It's very helpful. So I think rather than thinking about sleep, if you're already on hormone therapy and it's not fixing your sleep, then it's well worth looking at some of those other non-drug options, because they often really help get to the root cause of why you're not sleeping. And that obviously has flow-on effects to anxiety and fatigue and all those other things, that we often experience. The other thing to mention about anxiety is there are a lot of studies that show how powerful exercise is at reducing anxiety. And I've got to say, I don't make a lot of friends when I tell people that. No one really wants to hear that they need to do more exercise, but it's incredibly powerful. And actually, you don't need to do a crazy amount to get the benefits. So I'd often just recommend starting out. If you're not doing much at the moment, start out by having a 10-minute walk every day. And it's really helpful to notice how you feel before you go out for a walk, and then how you feel after. And really think, did that sort of help my anxiety? And but we definitely know that exercise is incredibly helpful for anxiety and mood as well.
Yeah, that's true. And I think the research is showing a lot of the times, not in all cases, but a lot of the times, the prescribed exercise therapy, and they're not big interventions, versus the standard antidepressant therapy is having better results for like low-level anxiety.
That's absolutely right. So for mild to moderate anxiety, it's actually better. It works better than medications, and obviously has virtually no side effects. So it's an incredibly helpful intervention, and all of us can do it, and it's free, and we can do it whenever we want. I think it's a really useful tool. So it's very helpful to talk about mood. So yes, depression is much more prevalent in postmenopausal women than it is in premenopausal women, and there are structural cognitive issues around low estrogen that are related to that. So if the hormone therapy itself then helps the mood, great. If it doesn't, then again, we'd be wanting to look at some other reasons for why that might be happening. Again, counseling, so cognitive behavioral therapy and other sorts of talk therapy are incredibly helpful. And so I'd strongly recommend talking to your GP about being able to access, say, a mental health care plan to be able to see a psychologist, and that can be subsidized by Medicare. But sometimes it's absolutely appropriate to use antidepressant medication. Some of those medications also have a really helpful side effect of helping hot flushes. So sometimes we can kill two birds with one stone. But it's not unreasonable that if things are just not working for your mood or for your anxiety, it's absolutely reasonable to talk to your GP and really consider some of those antidepressant and anti-anxiety medications, that they work much better in conjunction with doing that exercise, getting the sleep, having some good stress management techniques, and also making sure you're really trying to focus on that sort of whole food diet with lots of plants. So doing it sounds like a lot, doesn't it? But you don't need to be the best at everything. It's just taking a little bit from each of those columns and applying that actually makes a huge difference.
Yeah, just like you said, a little bit of investment in each of the foundations, exercise, trying to improve sleep, trying to improve your diet if you're not eating so well. They're all going to have a great impact.
They are. I think something that comes up a lot is that, we actually all know this. I'm not, everybody knows that doing exercise and eating veggies is good, and is good for your health. But the problem is actually the implementation. I think that's the difficulty. We're all super busy. We've all got our habits and our routines during the day, and sometimes it's very, very difficult to change those. So something that I definitely encourage, listeners to do, if they're really struggling with implementing some of those changes, it's a great idea to see someone about it. And there's lots of different types of someone who can help. So I live in this sort of GP lifestyle medicine space. So someone who is interested in lifestyle medicine will definitely be able to help. There are a lot of health coaches around who can help. There are often nutritionists and naturopaths who are able to help in this space as well. There are even some nurse practitioners I know of who are working in this sort of lifestyle implementation space. So there's lots of help out there. It's absolutely not anyone's fault that it's difficult to implement. It is hard. It's one of those things that's simple but not easy. So I think if you're struggling to implement, please ask for help, because it makes a really, really big difference just to have some guidance, a bit of a pathway, and stop that feeling of overwhelm that I think it's really easy for all of us to have when we're trying to change too many things in our life at once.
Yeah, that's great advice. Because often it's overwhelming. It's like, well, I'm already busy. I can't spend time like planning a healthy grocery list or planning new meals. I just need to be having my standby meals and stuff like that. So I think that's definitely where lifestyle medical practitioners or health coaches can be handy.
Absolutely. And I suppose, it's probably worthwhile mentioning the internet. I have a real love-hate relationship with the internet. I've got teenagers, and honestly, it's just a nightmare trying to navigate access, and anyway, that's
Yeah.
another podcast. But if I'm thinking about the internet, that I think contributes hugely to overwhelm. So access to doctors, access to health coaches, sometimes that can feel like a lot to then have to make an appointment, and, it costs money when there's a lot of free information online. But I suppose I say this because, 80% of it is just absolute garbage, like absolute garbage. And people have their health beliefs for a whole range of reasons. It's not just doctors who know the things that we need to know about lifestyle medicine. Again, there are lots of other really well-qualified medical practitioners and allied health practitioners out there who can help. So I think it's about looking for somebody who has clinical experience, not I did my own research experience, but actual clinical experience, helping people, one-to-one, and being able to give advice, rather than people who sort of have opinions. It's hard to know who to take advice from. Do you feel for people sort of out there in internet land?
Do you feel like, because I've been looking into the health coaching space for quite a while, do you feel like that's going to be more prevalent where qualified health coaches are going to be working in tandem with maybe lifestyle medical practitioners or GPs? Because as you know, like the GPs, the generalised GP only has a certain amount of consultation time, and they don't have the time or resource to be having those follow-up conversations with the patients about how are you going with your diet, what kinds of foods. So do you feel like qualified health coaching space, they might work more in conjunction with each other?
Yeah, so what you're describing is a fantasy world that I want to live in, because I think that it would be wonderful. I think it would be so, so helpful for everyone in our community if we had true multidisciplinary practices. There's lots of logistical issues around why that doesn't happen. A lot of them are around the way we're employed. Like most GPs are self-employed, so it would be very rare to have, say, a practice where everybody is an employee and they're all working together. So there's some logistical issues around it. But in principle, I think having health coaches as well as allied health staff, so dietitians, nutritionists, exercise physiologists, physios, health coaches, everyone coming together and having a true multidisciplinary approach to health would make the world of difference. And there's definitely been trials, both in Australia and overseas, to show that, yeah, people's health outcomes are absolutely better if they have a team of people caring for them. And so, yeah, I think that would be a wonderful, wonderful thing. And I do hope that it's something we see more of. And it does probably require a little bit more in the way of government funding and enthusiasm for these sorts of things, which,
yeah,
you might get there.
it's the dream, like you say.
Exactly.
Okay, so as you mentioned before, the HRT patches in Australia have been really hard to come by in the last recent months. So someone asked, they were unable to get their normal brand of HRT patch, and the pharmacy gave them a different brand of patches, which happened to be made in Germany. They've said that although the strength of the active ingredients is supposed to be the same, could there be differences to explain a heavy breakthrough bleed that this listener had soon after starting the new patches?
Yeah, that's a great question. So yes, there can be differences. So in the patch, if it says it has, say, 100 micrograms, it has 100 micrograms. But different, as I mentioned, the glue will be different from one patch to another, and the area is different. Some patches are really big and wide. Some patches are really tiny. So it does depend a bit on if, let's say, this lady started off on a tiny patch and it absorbed beautifully on that tiny patch of skin. If she moves to this bigger patch, then it may actually not be absorbing very well over that area of skin. So that could definitely be one reason. Generally speaking, I would never be keen to just sit and wait if there was a breakthrough bleed, even if it looked like there was probably a reason for it. If you've been well established on menopausal hormone therapy for quite some time and you've really never had any breakthrough bleeding and it's been pretty stable, and then all of a sudden you have a breakthrough bleed, it really warrants investigation. And the key is usually a pelvic ultrasound to look at the thickness of the lining of the uterus. So it may well be that if she'd stayed on the same patch, on the same day, she still would have had the breakthrough bleed. We don't know. So yes, it's possible, but I wouldn't just wait and see what happens. I'd definitely have a look. If it turns out that the endometrial thickness, so the thickness of the lining of the uterus is absolutely fine and nothing to worry about, then we'd probably say, well, you're maybe not absorbing it as well. Maybe we increase the dose. But I think the first step is always to get breakthrough bleeding investigated, even if you think you know why it's happened.
Thank you. That's great advice. What about when you're just initially starting, say, in the first 4 weeks of starting your hormone replacement therapy? What can be normal in terms of bleeding when you first commence the hormones?
Yeah, so it's different for perimenopause versus postmenopause. So in the perimenopausal time, you may have regular periods, you might have irregular periods, it could be anything. When you start menopausal hormone therapy while you're still having a cycle of some description, you may find that your cycle changes. It might be shorter, it might be longer. It shouldn't be heavier, but it may well be lighter. So you may notice some changes. You may not notice some changes, and all of that is fine. If you're postmenopausal, you have not had a bleed for 12 months, and then you start on menopausal hormone therapy, then it's really common and not concerning if you do have some spotting within that first 3 months. Usually it will stop within that 3 months. And if the bleeding or spotting persists after 3 months, then yeah, you've really earned yourself a pelvic ultrasound to make sure that there's not a particular reason. And the reason being, let's say you're postmenopausal, your body hasn't had estrogen there for a little while. We give you external estrogen, we might set off something that had been sort of quietly asleep. So something like a polyp in the lining of your uterus, or an endometrial polyp. We might just tip you over into having a thicker lining of the uterus. So there's we might reactivate a fibroid that had gone to sleep. So there's a few reasons why it might happen, and it's always just good to know why. So if you spot within the first 3 months and you're postmenopausal, then just wait it out. But if it's still going on at that 3 month mark, you'd really need to talk to the prescribing doctor about it. What I wouldn't want you to sit on for that whole 3 months would be heavy bleeding or painful bleeding. So it shouldn't be heavy. It shouldn't be like day one of, the period you used to have. I'd accept some sort of, just light spotting here and there, but it shouldn't be much more than that.
Okay, so get the heavier bleeding checked ASAP.
Yes, please. Yeah.
Yeah, thank you. The final question we have is, well, I think you've just answered it.
Sure.
It was going to be with regard to bleeding while on HRT. When should I follow up with a medical practitioner?
Yeah. And look, I suppose just to summarize, essentially, if you haven't had any bleeding and you're well established on your hormone therapy, and then randomly you start having any bleeding at all, get it checked out, because it can, again, be something like a polyp, or the lining of the uterus is too thick. And the reason why we get a bit freaked out by this as doctors is because on rare occasions they can be cancer. Not all spotting, certainly not all spotting or bleeding or thick lining of the uterus is cancer, but there's, it's a very, very small risk, but of course it's a really significant risk, and we absolutely do not want to miss it because it's completely treatable generally at that stage.
Yeah, early detection.
Yes, absolutely.
That's
So
great.
it's always just better to know rather than not know.
For sure. Thank you. Wow. You've explained things again in such a clear manner. And I think it's a broad range of questions, but I think they're questions a lot of women will have.
Yeah.
Is there anything else that you can think of that you'd like to raise awareness on, or anything we haven't covered today?
I think probably there's still a lot of fear around menopausal hormone therapy, and women are getting really mixed messages. Even yesterday, I was having a chat with a patient, and unfortunately, her GP had told her that she was on too much estrogen for some reason, and so she'd stopped and come back to me, and I think it's really hard. Like I really, really feel for women, because there's just so much conflicting information. I guess the reason I say that is that it's probably good to have a few links to information that's accurate, a few places where you can go and look for answers, and those answers are going to be right. So in the show notes, it might be worthwhile, Cass, if I just pop down a few links, but the ones that come to mind would be the Australasian Menopause Society. So they've got lots of fantastic, really easily accessible information. Jean Hales is a group that's run out of Melbourne, and they're incredible. They're going to have accurate information. And there's a few other places that it's worthwhile looking to. The WellFem website. So WellFem's got excellent, accurate information, really great blogs. So if you're just not sure and you can't ask your GP for whatever reason, then at least go to a reliable site where you can find information that hopefully will answer your question and also be correct, because I think there's a lot of confusion, and the confusion, of course, leads to fear, because how do we know what's right?
Yeah, I will put all of those in the show notes. And I think we've mentioned on the podcast before, but the Australian Menopause Society has a search function. I think you can search for doctors who have, undergone some further training and have an interest in menopause, and they're listed on the website. But yeah, I think it's definitely great advice for, when I'm speaking to my friends, I'm saying you might want to think about having your normal GP who you love and you've seen forever. But if they're not interested or they're not educated in menopause, because let's face it, not every doctor is, then, ask your girlfriends, go on to the Australian Menopause Society. Yeah, try and find a doctor who is more educated and definitely interested, I think, in this type of medicine.
Yeah, I think that's absolutely true. And one of the issues is for us as doctors, it's such a fast moving world. There are so many new treatments for so many different conditions. And medicine, even since I finished, but now I think about it, that was like more than 20 years ago. So anyway, in the past 20 years. Like, it's just the amount of information that we as doctors need to know has increased exponentially. And we're just human and actually don't have the hours in the day to be able to be up to date with all the research on all the things. So I'm sure that a lot of listeners will notice that a lot of GPs have subspecialized. So in my area, a lot of GPs will only do skin cancer medicine or, only see kids. So, and the reason is because we can only be good at our jobs if we know what we're talking about. And, the other GPs that work at Wellfem, we spend an enormous time outside of work just reading, talking to each other, going to conferences, just keeping up to date. And just keeping up to date with the menopause information is, that's a lot of work. And so it's quite reasonable that your regular GP doesn't have the time to do that. So I'm sure they've got their own thing that they're good at. So yes, the Menopause Society website's fantastic. You can find doctors in your area who are interested. And also Wellfem, we're there. There's lots of us, and all of us have, a real passion for menopause care, but also for a much more holistic look at it, a much more holistic reason for all of the other contributing factors to your health in that sort of midlife period.
And for everyone who hasn't listened to episode 3, where you were on before on the podcast, can you just quickly give us an overview of Wellfem, a telehealth consultation?
Yeah, absolutely. So Wellfem is a dedicated telehealth platform for women to get help with perimenopause and menopause care. So it was started by Dr. Kelly Teagle back in 2017, and she saw that there was a really unmet need for women and something that could be very safely done over a telehealth platform. So she's expanded the practice now to over 20 we're all female GPs, and we've all got a particular interest in menopause care. So you can, jump on the Wellfem website, have a look through all of the doctors' bios, see if there's somebody who particularly appeals to you. But we actually do spend quite a bit of time talking to each other about, complex cases or things we're not sure about. And so although you're seeing one GP on your telehealth, you've actually got an extra 20 GPs in your pocket, because we'll all be talking to each other if there's something that we're not quite sure about. We're all very up to date with the latest information as well. So, so Wellfem's a good service.
It's a fantastic resource, and it's available to women all around Australia. Is that right?
Yeah, so it's Australia-wide, and it's a video telehealth service. So much like you're seeing me now, you'll see exactly the same background when I'm working. And we spend initially at the first appointment 40 minutes talking to you. That's after you've filled out an initial questionnaire, just with the nuts and bolts of your medical history and your concerns. So we'll spend 40 minutes going through everything and coming up with a plan, whatever that may be. And then we can review you however often is needed after that. We also have a clinical nurse who's working with us now, Jules, who is wonderful. And she's also a lifestyle medicine specialist. So she's available to have specific consultations, so nurse-led consultations around some of those lifestyle changes that we can probably all make around sleeping better, around nutrition and exercise, and just the extra support. So she's really our health coach. And I think she's a wonderful asset. She's a lovely, lovely person. So I think, she's a great resource if you're just interested in having some health coaching as well.
In addition to your working with Wellfem, you have your own medical practice on the Sunshine Coast.
I do. Yes, I've got
called Vitality Lifestyle Medicine. I have had a few people reach out to me after listening to episode 3 asking if they wanted to work with you personally. Are they able to do that? How would they go about that? And also, could you speak to any offerings you might have coming up with your business?
Yeah, sure. So, about a year ago, I opened up my own little one-woman practice called Vitality Lifestyle Medicine here on the Sunshine Coast. So I do, I suppose, something similar to what I do at Wellfem, only face-to-face. So I don't do any telehealth through that business. And that's for menopause care, but also for general lifestyle medicine challenges. So I see a lot of women who perhaps they might have noticed that their blood pressure is going up and they need more medication. They'd like some advice about lifestyle changes, or around weight loss or around, say, joint pain. It could be anything. So, that's my face-to-face practice. And if you're interested, I'll pop the website in the show notes, so you can make appointments there through the website. And I found it really interesting, some of the questions that your listeners had asked, Cass, because they definitely speak to what I would say is a bit of an epidemic of absolutely knackered, exhausted women around that sort of perimenopausal, menopausal age. So I'm putting together a program now to help women who are just feeling like they're tired. They might be doing all the things, their blood tests might be looking absolutely fine, but they just still can't really find their spark. And I suppose another comment women have is often, I just don't feel like myself anymore.
Yeah.
So I'm putting together a program to help guide women through a process to really help understand what's happening with their health and just try to implement some small changes week by week to really start to get that energy. And I do it with my patients in the clinic, and it works really, really well. So if anyone's interested in that, my program is called Energized in 8. So it's an 8-week course that's all done via Zoom. And if you're interested, we'll again put the details in the show notes.
And so is that available for people who aren't on the Sunshine Coast?
Absolutely anyone, yeah. So there's no face-to-face component to it. It will all be done over Zoom, and there'll be some other resources that they can access just online. So you don't need to be a local for that. You can have a look at the website and check it out. But if you're struggling with your energy levels, then certainly I'd be happy to try to help out.
Thank you. That sounds great too. And what about online, Instagram, Facebook? Where can people find more about you?
Yeah, so I am on Instagram and Facebook. I have to admit, I don't spend too much time on Facebook. I love Instagram. I think I love Instagram a little too much, actually. That's probably my little lifestyle thing that I need to maybe do a bit less scrolling. So I'm on Instagram at vitality.lifestyle.medicine. I love to have interactions with people on Instagram. So if you want to sort of drop me a line, or if you've got any questions. So Cassie, if any listeners do have any questions and I haven't answered them, I can't give personalized medical advice, but if it's sort of general questions about menopause or lifestyle medicine, feel free to DM me, feel free to send me an email. I'm very happy to have a chat. I like a good chat.
Thank you so much. Again, in the show notes, we'll link to your Instagram and Facebook as well. And before we let you go, I'd just like to ask if there's one way you're planning to mind your being this week.
There's two things I'm planning. I've been quite slack. I've been quite busy with work, and I've been a bit slack with catching up with my girlfriends. And I find that I get withdrawal symptoms when I haven't had some chats. So I definitely am prioritizing that on the weekend. And also, I've had a broken oven for a couple of months, and I've just had a new one installed. So I'm planning to actually get back and do a weekend of cooking. I love cooking. I'm like a mass producer of lunchbox items. I'll do a massive cook up and then freeze it all and then run out of space and have to stop.
Perfect.
So they're the two ways I'll be minding my being.
You've got food and social this week. Tick, tick.
Two of my favourite things.
Oh, Lisa, thank you so much for coming onto the podcast again. I really appreciate it. And I really think that it's going to be so helpful to the listeners. Thank you.
Oh, thanks, Cass. No, thanks for all the work you're doing. I think it's great to have podcasts like this where women can come and have access to good information and potentially just get the conversation started.
Well, it's only possible with generous guests like yourself who've agreed to come on at your own time. So thank you.
No problems at all. Thanks for having me.
Thanks so much for listening to this episode of the Mind Your Being podcast. If you enjoyed it or found it helpful, please follow the show wherever you get your podcasts and share it with a friend who might enjoy it too. If you have a moment, please leave a quick review. It really helps others discover the podcast. Thanks again for being here. Take care, and until next time, mind your being.